Good morning, and welcome to today's webinar titled Driving Improved Outcomes Through Process Efficiency. My name is Jeanette Wider, and I'm Managing Editor of Healthcare Innovation. Today's program is sponsored by AirSlate and Salesforce. Thank you to our sponsors and to our audience for giving us your time and attention today. Before we get started, we have a few housekeeping details. To submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program. For technical issues, please press F5 to refresh, and if that doesn't work, you can submit a question with your issue through the Q&A panel. Finally, join our webinar conversation on Twitter. You can tweet using the hashtag HILiveWebinar. At this time, I'd like to introduce Rick Reed, Senior Product Manager, AirSlate. Hi, Rick. How are you today?
Hi, Jeanette. I'm doing really well. How's life treating you?
Pretty good, pretty good. So I was thinking we could start today by you introducing yourself, just a little bit about your background, and then we can hop right into the questions.
Great, thank you. So as you said, my name is Rick Reed, and I am a Senior Product Marketing Manager at AirSlate. And AirSlate basically is document process automation. We like to say everything you need to get your documents done. I've been here for a little while, but I've been focused in working in healthcare in general and in process efficiency probably since like early 2000s, 2005 or something like that. So I've in various different capacities. So I've been thinking about how to make things easier and how to improve patient outcomes in various capacities in healthcare situations for quite a long time now.
Well, that's a great start, because my first question for you is, how long have you been thinking about improving processes in healthcare? Maybe you could expand on that a little bit for us.
Of course, yeah. I started my career sort of as a wireless networking person, working for a couple of different wireless providers, some who still exist and some who don't. And really, it was in 2005 when we really started focusing on healthcare as a vertical market for wireless networks. The main problem that we had back in those days, or that healthcare systems back then had, was sort of real-time communication throughout a hospital. As anybody who works in healthcare system knows, cell phone coverage, which were still prevalent in 2005, but just did not have coverage throughout all parts of a hospital, whether it was in the basement or different floors or in elevators or in stairwells. And so we turned to wireless Wi-Fi and Wi-Fi enabled phones to provide coverage for those spots, to ensure that all of our clinicians and staff could maintain real-time connectivity and alerts throughout an entire hospital. And that's really where that started for me as a wireless design engineer, but designing for the problem of making sure that constant communications in hard-to-reach places in a hospital system were enabled. So that was really kind of an exciting thing in my first exposure. From that led into some of the innovations in communications that people were looking at. I looked at Vocera for a long time. Vocera, actually, coincidentally, their headquarters used to be about 2 miles from my home here, so I've known about them since they built their building. But that sort of real-time badge-based communication and making sure those work. And so whether it's Vocera or nurse call systems or any of the other badging systems that enabled through Wi-Fi, worked on implementation of those systems. A little bit later, I started working on, and actually as a result of Wi-Fi, but I started working on real-time location services. This is where you can actually locate people and things within a large building. And we did that via Wi-Fi, but also doing Bluetooth. And these started really talking about process improvements in a variety of different ways. Because when you can look at where a thing or a person is in a specific environment, then you can see where it travels and then where you can make improvements in that travel. So we worked in like nursing room assignments, patient flow, biomedical device, and even patient experience. Just a couple of highlights. I remember we worked on a project at a hospital in Seattle, and it was a nurse flow issue that we were trying to solve in an ICU. And we were just tracking the steps and tracking the locations of the nurses and their rounds throughout the day. And it seems really simple in retrospect, but they had a typical, sort of square ICU with like 15 rooms. And the nurses had been assigned to, each nurse would have a room on each sort of leg of the square, if you will. And they ended up spending a lot of their day sort of taking steps or walking between their different patients. We did a little bit of analysis and saw that it was taking time to get from one room to the other. So we made a quick a simple change, which was assigning the nurses the rooms in sequence right next to each other. That reduced the amount of steps they had to take through the day, but more importantly, it reduced their time to response. You can imagine if they were in one corner of a square and they had to respond to a patient in the opposite corner, it may only be a couple hundred feet, if that, but it still reduces the time if all I have to do is go next door. And that made a big improvement in outcomes and also nurse satisfaction. The other thing I like to talk about is patient experience and hospital navigation. We built a lot of applications to help patients and more specifically get guests through an application being able to navigate their way through a hospital, doing real-time indoor turn-by-turn directions. So if I come into the lobby and then I was asked to go to, say, X-ray, instead of having to follow lines on a wall, I have a Google Maps-like experience, but inside to the hospital. So being able to navigate specifically inside. Those are some of the things that we worked on to really improve process and improve patient and guest satisfaction as we go in there. Now what I'm thinking about with AirSlate is how we do document automation. Healthcare is a document-heavy process. There are a lot of signatures. There's lots of information that has to be passed between multiple systems. If you just think about that patient intake, process for a couple of minutes, and the different types of documents that you need signed and filled out, or even clinician onboarding as they contract or come into a hospital system. We really think about the places that we can do to improve those types of systems and make that process easier for everybody.
Very interesting. So what changes have you seen over that time that lead to process improvement?
Yeah, really, I look at a couple of different watermarks, and nothing is really super recent. Really, I look at the start of HCAHPS, which really was introduced around 2008, 2009, right? Customer satisfaction surveys. And what you realize, of course, is, patient satisfaction matters. And it matters not only because we like everybody to feel good, but it also matters because patient satisfaction affects Medicare reimbursement rates, right? So we know that how you improve that process. And for those of you who've ever actually read through the HCAHPS survey, I like to say it's a soft survey. It's a subjective survey. It's not, are you better? Are you healthy? It was always about, how did you feel about your experience in the hospital today? How did the nurse, how did the doctor make you feel? So it was soft and subjective. So what we started thinking about was those sort of experiential ways in order to improve that, which led us to really examine the processes that we are operating under, what was the purpose for that process, and how you can make it better. You follow up that really shortly with really the iPad I noticed, started changing everything in 2009. We'd sort of already turned over to electronic health records and trying to provide computerized care, but it was really the tablet that really easily connected to the network, really connected into the applications, and really allowed the clinicians to truly be mobile as they went around and provided care. I remember this experience I personally had in 2005, a little bit earlier. My daughter was born in a hospital, and she had some minor complications. But I remember that the doctor would come into the room, and he would offer his opinion on what was going on and what the treatment plan was. And I was able to sit there on a Wi-Fi device, research what he said. He would have to leave the room and go back to his desktop computer to answer the further questions I had, rather than answering the questions real time in front of me. So that really changed everything, with the information both in the EHR record and just sort of general diagnostic information was in the clinician's hands. Of course, everything changed with Affordable Care Act in 2009, 2010, meaningful use. And what I saw was really the explosion of data connectivity, right? Whether it's EHR or whether Salesforce has a data patient and data repository, but everything was connected through those. We've already got the wireless side and the computer side connecting to everything, and that just drove a gigantic explosion in everything that we have the ability to do. Even if you think about how you store data in the real-time services, whether it's nurse actions or whether biomedical devices moving around. We actually did implementations with biomedical and CMS software where you could say the status of an infusion pump, for example. You know what its clean status, its in use status, but you also real time knew exactly what room in the hospital it was in. Those kinds of things were really amazing changes. And that was all allowed through, of course, the wireless data connectivity, as everything in the hospital started adding wireless as it became more and more prevalent. And those changes have just driven all of the efficiency stats that we've been looking at in the past several years.
So you're saying 2010 wasn't last year, even though it feels like
it wasn't last year. It's been a long time. And we know that, typically, in healthcare, it's fairly conservative in terms of change. So it takes a long time for those things to really really take hold.
Right. So I know you mentioned a little bit earlier in our discussion, but what departments have you worked with?
One of the things I've loved about my particular experience is you do get to work with a lot of different departments within a healthcare system. And it's not just healthcare system, it's small clinics, single doc shops, as well as large systems. And I've kind of worked with them all. My favorites are always sort of nursing. Nursing, is the backbone of any healthcare organization, really doing primary care, first and most often touches of all the patients and have sort of the biggest impact. So working on things that allow nurses to have connectivity, communication, and then efficiency in their workplace. And whether that's with the clinician themselves or with the management, and then even with the software and the security, the hardware that supports their jobs as well, nurse call systems and things like that. I really also, working with biomedical teams is really interesting to me. Biomedical folks are generally super smart, but they're mechanical engineers by education generally. They started adding this networking component into all the biomedical devices so they could be connected and send real-time data back and through. So it was sort of keeping those informed, of keeping the biomedical engineers sort of teaching them about networking and why and how that matters, and location and things like that. And it was really interesting, and even today in a healthcare environment, how biomedical fits into the overall structure of a healthcare organization is always very interesting to me, what the model is that operates under. In the last several years, I've been working with the CXO, the Chief Experience Officers, people whose job it is to think about how happy our patients are going to be. And it's sort of a relatively newish invention. The position is, last 5 years kind of exploded in major hospital systems. But that's one of the things I really like. What does it really look like? How does it feel to walk into a hospital system? What does it look like when I use the app or integrate with my patient, with my clinician, and a screen, either at home now in COVID times, and what that looks like and how easy is it to do? And all that is underlined, of course, with IT, right? Whether it's hardware, networking, infrastructure, switching, or software services, data repositories such as an EHR or Salesforce or nurse call systems or voice operating systems. IT underlines all of that things together. So I've really had what I think is kind of a holistic approach to really how we approach working with healthcare and the understanding that all the requirements that each one of those groups have.
Okay, so the next question I have for you, why is process improvement in healthcare so important?
Well, the most important thing is we do have all of these data systems now that store data, but I'm always amazed at how much information in any healthcare environment is still recorded by hand. And the challenge with recording data by hand is you have to input that into electronic systems somehow. And there's always an opportunity for an error, or inaccurate data, or those things. So accurate data moved efficiently between systems simply leads to improved outcomes. How fast the clinician gets information, how accurate it is, whether it's diagnostic information to a clinician, whether that's personal information or history about the patient themselves, all of that happening quickly and automatically in real time drives improved outcomes. And after all, that's what healthcare efficiency is all about, is these improved outcomes, right? So we know that better data, faster, more accurate, drives better outcomes. But when you have those systems in place that a clinician can rely on all of the data that they're getting in real time, then clinician well-being matters as well. Clinician may not be as frustrated with the lack of timely or proper information. They can diagnose better, quicker, more efficiently. We've just talked already this morning a few things about how patient attitudes and patient satisfaction results in improved outcomes, how they're feeling about a system, how many pieces of paper do they have to fill out, how many times do they have to write their name, address, and birthday down at the top of a piece of paper as they're going through this process. Healthcare, and one of the reasons I like working in healthcare so much, it's a universal experience, right? Everybody has to visit a hospital, has to visit a doctor for some reason or another. Everyone gets sick and is subject to this experience. And you have to make it better. There's always ways to make it better, both on the surface from an experience perspective, but also under the hood from a time and efficiency perspective. And all that just drives to better patient experience and improved outcomes.
Right. So one thing that I've been learning a lot about recently and all over topics we cover on healthcare innovation seems like a hot topic right now is automation. So how does automation assist in process improvement?
Yeah, automation is a really interesting thing. You have to look at the places where automation can actually provide benefits to you. So the first step is really you want to look at your process and map it out. How does it work today? So what kind of systems are involved in this process? Right? And really the second thing there is what is the end result? What is the purpose of this process? If I take, for example, maybe a patient intake scenario, right? The end result is to have a complete picture of who this incoming patient is on this day. And where do I want that information stored? Do I want it in an EHR? Do I want it in some sort of repository? Do I want it just on a web page? Do I want it on a piece of paper? What does that look like? And then what are the pieces of that? What kind of hardware might be involved? Is it a tablet or a computer workstation? What kind of software might be involved? Is my integration to Salesforce? What people are involved in the process? There's a patient, there's a staff member, the administrator, there's a nurse who looks at it first, there's a doctor who looks at it second, and where is that information required to be, right? When and where. So all those things need to be mapped out, where it happens, what the conditions are for different information going in different places. Once you have all that mapped out, you look for the places where you can automate certain tasks. If you want to send a document from one person to another, can you do that automatically without anybody having to print out a piece of paper or make a copy and hand it to them, or put it in a folder and put it in a holder on the door, right? How do I deliver that information? How do I send that document? How do I move data within the system? So if I just consider like my name and birth date, how does that information go from a piece of paper that I might have filled out as I signed in into my healthcare record, into the diagnostic record, into any orders, into any consent forms? How does that data move? And moving data is an easy thing to automate. And then storing information. That's an excellent place to look for automation. I take in information in one place, then I can automatically store it in whatever system of record I have available to me. And then once it's in that system of record, I can update it automatically as I get new information, or I can take that information and pre-populate or pre-fill other documents and other things I want to be able to do. This makes everything just faster in general and more accurate. I actually truly have a single source of truth that I can update if required. And if you think about things where in document automation specifically, right, the document itself, the piece of paper, is at the center of the whole process. But what information is collected, what gets filled into it, who needs it, and when do they need it, and where do they need it, are all types of places that you can look at to make things sort of automatic and more efficient.
Okay, so we all know healthcare is a unique industry, right? So what are some of the unique challenges you face in healthcare as opposed to other industries?
Yeah, my experience is really it's that sort of pace of providing service. If you're looking at different processes, and especially if you're trying to analyze a process that's happening, you have to watch it in real time. And the pace that healthcare provides services, especially in a hospital system, are just pretty fast. And you can't really shut down a process and really take the time to diagnose the steps and the efficiency. You have to sort of do it in real time because they're providing care. You can't really stop that. And really in healthcare, change disruption is actually a really big thing, right? You want to find ways to improve your efficiency, but without really heavily modifying the process on the surface. Now, I'm sort of a efficiency person. As I said, I have a long kind of varied experience in what parts I'm doing that in. But the hospital system, the administrators and the staff are clearly the experts in their process. So I don't really want to, and that process was developed probably over years and years of experience and education. So I don't want to modify that process too much. I just want to find the pieces where I can go to make it more efficient. Process is the process for a reason. And if you change the process, you can have really big implications. What AirSlate does for us, though, is we really have the advantage of we're going to do our best and be pretty successful at conforming to the existing process. Our solution is flexible enough that we're going to fit into how you operate. We're not going to make the patient onboarding system sort of fit into what our model of automation is. We're going to take your process, move those documents and data to the places that you already know you need them. So the process itself won't change as much. We're just going to make it a little bit more efficient because you don't have the ability to really do a major change all the time.
Okay, so right now we're going to push a poll to the audience. The question we have for you, for our audience today is, what document process takes the most time to complete? Patient intake, procedure consent, or field notes? Just waiting. It's always, feels like much longer than I'm sure it really is. But we want to make sure that everybody has time to answer this. Okay. Rick, I'll let you, if you want to say a few words about this.
Actually, I can't see it right this second. No, I got to click over on the survey.
Yeah, no problem. Take your time.
Oh yeah, this is really nice because this falls in pretty much with exactly what we see. Patient intake, well, field notes really kind of the major thing for this group, followed closely by patient intake and procedure consent, and that mirrors pretty nicely with what we see from a use case perspective at AirSlate.
Okay, so the next question I have for you for AirSlate, where do you see the most benefit for automation?
That's a good question. And I don't mean that by hard question. I mean, that's a great question. What we focus on, of course, is a document process, right? And our ability to automate most parts of that. And so as our survey indicated, a lot of our customers do implement us for clinician field notes. So if you imagine a home care provider goes into a home, provides service or whatever it is, physical therapy, rehab, or whatever in the home, and they have a tablet or they document that service and then actually can get the patient to sign and do that in real time kind of on this tablet right in front of them. It's a pretty large use case for us. Patient intake is another giant one for us. Probably about, well, at AirSlate, about 30%, 35% of our customers in general are healthcare organizations of various sizes. And of those, one of the bigger use cases, probably about half the use cases, implemented use cases in healthcare, is patient onboarding or patient intake. So you think about that, I like to tell the story. Unfortunately, about 6 months ago, I had my dog at a dog park, and I tried to break up a little bit of a fight, and I ended up with a dog bite on my finger. So nothing too severe, ended up a couple of stitches, but it's a Sunday morning. I wrapped it up with Band-Aids and paper towels at my house and drove myself to an urgent care, a place I hadn't been to before. This was only about 6 months ago, so lots of colds and flus running around. The clinic was actually fairly busy. And I finally get to the window. I'm handed a stack of paper to fill out by pen. And thankfully, my injury was on my right hand and I'm left-handed, so at least I could actually fill out the piece of paper. But I am left-handed. I don't have the nicest handwriting, and I'm bleeding. So, they're trying to fill out my name and address. There's probably 5 pages. Each would have my name, date, birth date, and address at the top. I turn in all of my paperwork, and then I sit there for about 5 or 10 minutes, and I get called back up because I was bitten by a dog. That started off a whole nother process for obviously the rabies concerns from a healthcare concern, but also reporting to the county for those kinds of things. So I had to go out and fill out a whole nother stack of paper with all those other things. Okay? So clearly not an AirSlate customer. What we're able to do with our other customers, though, is change the feeling of that patient intake. So if you can switch your patient intake over to electronic means, maybe have them on a tablet, and this is what a lot of our customers do. You have a web form, a simple web form, where I can type in my name, birth date, all of my personally identifiable information. What that does then is sort of automatically create a record, say in Salesforce, right? But then what I can use that information is once I have that, I can kick off these processes that I need to have medical history document. I need to have insurance history document. But I can get those documents back to the patient pre-filled out with all of the information I already have. Like, I personally find it very annoying that you have to write your name and address. Thankfully, my name is really short, but if I had a longer name, it would be horrific. So patient intake, where you sign up electronically, you create a record, you use that record to pre-populate all these other documents, and conditionally create new flows, right? Depending upon what I'm indicating my healthcare problem of the day is, it kicks off urgency request, equipment request, pre-information. In my case, it could have automatically, kicked off this information going to the county and looking for the correct test. So patient intake, and then is all a part of that. So not only can you create the record, but then you can save these records into the system, export them, and then notify completion. So the county gets notified that there's now a dog bite here, and they can take actions as they need to do. Clinician field notes, we talked about that a little bit. Consent forms are a pretty big deal too, right? As I'm maybe having a surgery or anything else, any of these extra pieces of paperwork, I always feel like I'm in a hospital setting, I'm having this procedure done, I've already signed in, maybe it's a hospital I've been to or a clinician I've seen several times before, and they hand me a consent form, and I still have to fill out the name and address and date of birth. Like, at that point, I figured they should know who I am and be able to have that information, already in that thing. So that's something that clearly affects that. One of the things we like to do also with AirSlate is we like to operate a lot under the hood. So if you think about Salesforce, has a patient record keeper, we can allow administrators to have a single button in Salesforce that kicks off a document process. So maybe there is a consent form for a specific patient. So the administrator does not have to say, go into AirSlate has a piece of software and find out how to kick off this process. There's actually an integration into Salesforce where you just click on a single button on the record that says send surgery consent form. And then it will send that document electronically pre-filled and then allow for electronic signature. And then, of course, update throughout the entire process as you go on. And then one of the other things that we really see a lot in healthcare is actually employee onboarding. So not patient facing, but clinician facing or staff. Whether I have employees or they have contractors, sort of contract clinicians that have to be renewed, that contract process is pretty arduous and pretty time consuming. So the ability to automate a lot of those steps is actually really important too. And those are the main use cases that we see in healthcare. It has the poll indicated, it's very much, sort of field notes and clinician notes, patient intake process, and then filling down the consent forms, and then also leading into employee onboarding.
So who benefits from process efficiency improvement with your healthcare customers?
I mean, it's unbelievable who kind of helps this. You think about the hours that you spend, right? So it's all about time and effort being saved by all of those folks, right? So clinicians, as I've said, they get faster, more accurate data. Consent forms are clearer. Clinicians save time and energy in terms of explaining documents or reading things through, and really have the ability to really help those out. If you look at administrators and staff, right, the hours they may spend copying data off of a form, either by hand or data entry into an EHR system for a document that's been handwritten, trying to decipher somebody's handwriting, what the proper letters is, just hours of time saved by staff. We've seen sometimes patient onboarding, kind of the manual process, takes anywhere between 10 or 15 minutes sometimes to enter in all the information properly. If you do it automated, you can turn that down into quite literally a few seconds once the patient has filled out the information, obviously. So really saving that time and accuracy. So staff benefits from that. And also, like I said, AirSlate allows us to work within the applications that you're already working with. So staff doesn't necessarily have to learn a new system in order to take advantage of AirSlate. An AirSlate administrator will set up the process, but most of it's going to be in the back end. So, a clinician and or a staff member wouldn't even necessarily know that AirSlate was involved in the process. And then I always like to, because I am a healthcare patient, not a clinician, but I do like the experience can be better. If you go back to the dog bite information, story that I had a few months ago, if I could have just filled out that information one time and it populated into all the systems, that would have been really nice. Right? Here I am, been bitten by a dog, not super severe, as I said, but I'm bleeding. It's a Sunday morning. I think it was during football season, so I was missing a football game. Like that process could have been dramatically improved by the whole thing. And improving the experience is a big part of it, both in terms of time it takes to fill out forms and how many different forms I have to fill out and how many times a day I have to write my name and address.
So are you focused on improving one specific piece of the healthcare ecosystem?
Not really. We find that our use cases, if patient intake, is pretty universal. And it doesn't matter if it's a big hospital system, which we have a few customers in big systems, or whether it's sort of a smaller clinic or a single doc shop, whether it's sort of mental health or physical therapy or any of the affiliated services that come along with healthcare, whether it's a billing practice or maybe even a service that one of my favorite customers at AirSlate is CareTrack Health, and they're actually focusing on patient adherence. So especially with telehealth these days, but how you actually help patients to actually follow the things that they've been asked to do, whether it's medications or procedures or things like that. So really, all of that is available, and AirSlate is actually fairly cost effective. It's incredibly cost effective. So, as I said, even a single doc shop, to implement, to spend literally, a dollar per document on, saving 10 minutes of time is a pretty efficient. So whether it's a large system or a small clinic, we're pretty cost effective when it comes to that. And our customer list from a healthcare perspective is really sort of everywhere, right? Because everybody has those same problems of patient intake and notes and lots of forms that they have to document. Depending upon the industry, might even be a lot more, like, especially if things are, once insurance is involved as well, obviously then you have consent to disclose things and all these other documents. So really kind of lots of hospital systems and anything affiliated to it.
Okay, so we've already had some questions come in from the audience. However, I would also like to remind everyone that they can use the Q&A box to the left of your video window at any time. So Rick, let me pull these up for you. The first question that came in is, how are documents stored? Are there issues with HIPAA or other compliance standards?
That's a good question. And what's nice about AirSlate is we're not a document storage company. What we are is a document automation company. So where your documents get stored is your existing data repository. Like, so we can export the data within a document into a Salesforce record, but then we can also just install the entire document within the Salesforce storage environment. So whatever the storage record is for the clinic or the hospital is where AirSlate will work for that. And we are absolutely HIPAA compliant. So the storage piece belongs to wherever the document's stored, but as we move data around, then we have all of the processes in place to make sure that patient confidentiality is maintained.
Okay. Next question. What healthcare systems can AirSlate integrate with?
Yeah, AirSlate is pretty unique. So the way that we work is we create these process templates where you, as I said a little bit before, where you have these different steps and you can automate those pieces. In order to automate these pieces, we use what we call a bot. And a bot is just a little piece of software that handles the data movement or the document movement itself. And we literally have hundreds of them that do different things, whether it's move a piece of data or move a document, as I said. So the systems that we operate in, the data repository, we have lots of bots that are pre-built. So Salesforce, some of the other systems, and we can pull data in and out of Google Sheets and out of Airtable. There's literally hundreds of different systems that we can operate in. But you tie on top of that, we have a very robust API. So if you're coming across a system that we don't know anything about or we've not integrated with in the past, then it's very simple to use APIs in order to do these kind of document things. So if you wanted to put data, say, directly into, say, Cerner for today, but we do not have a specific bot for them, but we could be able to do that via an API call pretty easily. The difference is AirSlate is really built, so it doesn't really require an IT person to build these processes. It requires someone who's familiar with the process to build it. And so it's not, there's no coding involved. It's really, there's a flow creator that allows you to define the steps, and then you kind of pull a bot into that step to move the data where you want it to go. So APIs obviously require a little bit more expertise on the coding side, not quite as simple, but it means we're virtually unlimited in types of systems that we integrate with.
Great. So the last question I have right now is, how long does it take to get automation implemented?
It's actually pretty simple. As I said, the hardest part of implementing automation is documenting the process, knowing where all the pieces are, and then it's really simple to actually identify those places where AirSlate can have a big impact in that process through the automation. And then we find for the first piece of, we call it a flow, for the first flow that you build, for the first process that you build, there's a bit of a learning curve. But I like to say, if you know how to wrangle a spreadsheet, then AirSlate will be really simple. And it will probably take, if the process is documented well and you know what you're doing, it'll probably take less than a day in order to create a process that literally saves you hours a day in order to do that. So it's actually pretty straightforward and pretty simple and really easy to implement. Bigger processes take more time and more testing, but the simple things that you know what you're doing can actually get implemented very quickly.
How efficient. Well, unfortunately, that's all the time we have today. But I would like to thank Rick for today's excellent webinar. I would also like to thank AirSlate and Salesforce for making today's program possible. Finally, I want to thank everyone in our audience for joining us. We hope you'll join us in the future for another healthcare innovation webinar. This concludes today's presentation.
Thanks, Jeanette.